Vertex Ventures presents the all-new FDA-approved Pulse Cold Compression Therapy System.
The Pulse Cold Compression Therapy System is a revolutionary cold compression apparatus used for treatment to aid athletes and common consumers in rapid recovery for pain in joints and limbs following an injury and post-surgical recovery. In this video demonstration, you will learn how user-friendly and essential the Pulse Cold Compression Therapy System is to our consumers. The Pulse Cold Compression Therapy System, also known as PCCTS, is composed of 9 main components: a blue main canister with LCD screen for operation, a hose plug with male and female plug with a blue button, a power adapter, a complete user manual, water drain assistant tool. Each kit varies and is customized per patient. Lumbar, lower back cuff with extension Velcro straps. First, attach the extension to the cuff and ensure all parts are placed into position properly. Shoulder cuff with extension Velcro straps. Attach the strap to the back of the cuff and then apply over your shoulder. Ankle cuff, which can be used for arm therapy as well. Knee cuff. Let's begin by preparing in advance the right amount of water and ice in separate jars. Press the unit latch release button to open the top cover. Pour water into the canister until the indicated line. Do not go over or less the level line in blue. Now pour the ice until the maximum indicated level in blue. Do not go over or less the level line in blue. Close the cover and for optimal pressure, place the unit on a higher surface, allowing water to flow downward. Connect the power adapter to the wall jack. Be sure to apply your cuff over clothing or a towel to avoid direct contact with your skin, which may result in frostburn. Knee cuff. Ankle cuff. Shoulder cuff with extension straps. First, attach the extension to the cuff. Connect the hose into the pump until you hear a click, and ensure all parts are placed into position properly. Lumbar, lower back cuff with extension Velcro straps. Arm cuff. Connect the hose until you hear a click and apply on your arm. Fasten the Velcro straps firmly to ensure optimal benefit and pressure. Connect the hose to the cuff and make sure you hear it clicking to ensure the parts are positioned properly. Connect the hose into the pump until you hear a click. Plug in the power cord. When all steps are complete, your unit is ready to begin the therapy healing process. Press and hold the power button for 3 to 5 seconds. When on, you will see a welcome message on the screen. Press plus or minus button to choose the mode and pressure. Press the start button to start and pause the pump. The Pulse Cold Compression Therapy System is a complete user-friendly device, requiring no additional assistance for application as instructed by physician or therapist. While your PCCTS is working, you may take this time to sit back and relax. When the unit has concluded its operation, switch off the power by once again pressing and holding the power button for 3 to 5 seconds. Remove the power from the unit. Place the unit on the ground. Release the Velcro straps and hold up while squeezing the cuff, allowing water to flow downward back into the cooling canister. This step is very essential and has to be done properly to avoid water spillage and damage to the system. When you're done emptying the water from the cuff, disconnect the hose of the cuff before disconnecting other tubes. Press the blue button until springs detach from the cuff. Empty the water and ice. Use the water drain assistant tool to empty the remaining water from the cuff. Wipe down all parts to avoid damage and corrosion, and place all parts back into designated compartments in the provided blue case. The pulse cold compression therapy system is mainly used for post-operative care and acute injuries to aid in reducing edema and pain for athletes and the common consumer. Do not immerse system and any other electrical parts in water. Store in a cool, dry area. Patients who have a history of hypertension, diabetes, circulatory disorder, low or high blood pressure, heart disease, and women who are pregnant should consult with their physicians before using the PCCTS. Do not place the cold compression therapy system on open wounds. Do not use it if you cannot tolerate a cold compress. Patients with a history of cardiovascular disease should consult with their doctor.
Vertex Ventures. Recover smarter, not harder.